Hi, everyone. Looks like we just went live. Thank you, everybody, for joining us today for our Community Connection series. My name is Deirdre Carmichael. I am the Director of Workplace Campaigns at United Way of Lebanon County. And today's episode is about keeping kids safe. We know with schools canceled, more and more kids are at home all the time, and sometimes this can be a concern because for some kids, home is not the safest place. So for everyone joining us live, as always, feel free to type comments into our live stream comment box on Facebook throughout the stream, and we can get some of these wonderful professionals to answer those questions for you. So we're so thankful today to have three guests. I'm here with Ali Perrotto from the Sexual Assault Resource and Counseling Center, Jennifer Snyder from Domestic Violence Intervention, and Sharon Gassert from Children and Youth Services. So thank you, everybody, for being here today. We really appreciate the opportunity to talk with you all about this really important topic. So I just wanted to first give you all the opportunity to introduce yourself, share about the services that your organization provides for our community. So we'll start off with Sharon. Hi, Sharon.
Hi, I'm Sharon Gassert from Lebanon County Children and Youth. I'm the assistant administrator. Our agency investigates child abuse, general neglect reports. We provide foster care, adoption, and ongoing protective in-home services.
Thanks. How about you, Jennifer?
Yes, hi, I'm Jennifer Snyder, the Executive Director for Domestic Violence Intervention in Lebanon. The services we offer, we have emergency shelter for victims of domestic violence and their children. We offer counseling both for residential and non-residential victims. We do have a legal advocate whose office is at the Lebanon County Courthouse who helps in the filing for protection from abuse orders. We have public education programs for prevention and awareness. And I think that pretty much sums it up.
How about you, Ali?
So I'm Ali Perrotto, and I work at SARCC. We're a nonprofit organization serving Lebanon and Schuylkill counties, and we do work with survivors of sexual violence and also promoting prevention and healing in the community generally. So the work that we do includes a 24-hour support line, and I always emphasize that it's support line. For survivors, for their friends and family members, for anyone who has questions about sexual violence or what to do in the aftermath of the sexual violence and wants to talk with a sexual assault counselor. We also do crisis counseling, therapy services, support groups, individual advocacy and accompaniment. Our staff are phenomenal, and they are the folks who are willing to go out and be with survivors during really hard times or navigating systems that they're not used to, and just, being the champion for those folks so that they can make their own informed choices and start the path to healing. And then we do a ton of prevention work in the community also, working with children and adults alike on building the skills needed to prevent the perpetration or victimization of sexual abuse.
Awesome. Well, thank you all for being with us today. I kind of just wanted to start by talking to you all about how suspected child abuse is typically reported in normal times. What's the process? What does that look like? I don't know who wants to start there. Maybe Sharon would be best.
Generally, they're reported through the child abuse hotline, child line, and then they're filtered to the county, the appropriate county. Mm-hmm. That can be done online or over the phone.
Mm-hmm. Yeah. And our county CYS is absolutely phenomenal. Our staff work really closely with them and participate on the MDT meeting, which is a multidisciplinary review team for child abuse cases. And it is just an incredible group of people that care so much about children in our community and want to make sure that young people are safe and their families are supported. They're absolutely awesome. One of the things that SARCC provides as part of our prevention programming and work is mandated reporter training. So we've got 2 staff members in Lebanon who are certified mandated reporter trainers. So the state of Pennsylvania has laws that require that certain individuals, because of their professional role, have to first of all, know how to identify child abuse and then what to do in order to report it. They're actually legally obligated to do that. And we're one of the state-approved trainers or offering a program that would work for professionals, whether they're educators, doctors, funeral service directors. There's a whole list of professionals in the community who are considered mandated reporters by law. And we can work with organizations, with volunteer groups, with child serving groups or programs to help build the capacity for people to, first of all, identify the signs and symptoms of child abuse, be able to identify what their role or responsibility is for reporting it, because there's different for different types of child abuse, there's different requirements. So sexual abuse of a child, for instance, if you learn of something that happened even, 10, 15 years ago, if you're talking with a teenager and they report something that happened even a very long time ago, that's reportable up to the child's 18th birthday, even if it's a delayed disclosure. There are other types of abuse that are time limited and when and how you can report it. And so kind of knowing and understanding those nuances is really important for mandated reporters. And it's a lot to put on even volunteers in our community. So like the volunteer soccer coaches, or my kid's school district actually requires that you have to complete a mandated reporter training before you can go in and volunteer in a classroom, helping to work with our community members so that they see and understand their roles and responsibilities, and then have a really clear understanding of how they go about reporting it. As Sharon mentioned, there's an online reporting portal for mandated reporters that can be accessed through Keeping Kids Safe PA. And I'm happy to share the link with you all so you can see it in the public chat.
Yeah, we can get that posted in the comments. Or sometimes Flame comes on and posts stuff.
Yeah, I'm going to send it in the private chat, and then Flame can add it to the public, because I don't think I can do it from here. And then the other way that people can report abuse is by calling the Childline toll-free hotline. There's sort of an overarching umbrella for child abuse reporting in Pennsylvania, like a central repository for child abuse reports that then get filtered down into the counties, getting to folks like Sharon and her awesome team. And actually anybody can report child abuse. You don't have to be a mandated reporter to call this hotline. And the number for that is 1-800-932-0313. And that's available 24 hours a day.
Awesome. That's a lot of really good information, Ali. Do you have anything to add to that, Jen?
No, I just want to add too that we work with children and youth also, along with when protection orders are filed on behalf of children or children are involved, and also with individuals who might come into our shelter who have an open case with children and youth. They come in to do their visits, to have conversations. It's a great, we work, I think, pretty well with them, and they do a great job here in Lebanon County. And Ali, she did explain in depth, the reporting process, and as did Sharon with Childline or calling children and youth directly. Absolutely.
Yeah. So one of the things that Ali mentioned was that educators and mandated reporters play a big role in that process of kind of being able to identify the signs of child abuse and then being mandated to report them by law. So in the situation we're currently in, kids are staying in their homes. They're not going to school. What kind of impact does that mean? What does that mean for the safety of our kids if they're not in school or childcare?
I think it's really a deep concern. Educators, play an important part in keeping children safe, whether it's reporting to Children and Youth, Childline, or reaching out to SARCC or DVI if there's a child that they have concern about. And with the children not, being in school now, a lot of children look up to their teachers, and might just disclose to the teacher about a situation that might be happening. So it is a deep concern on our part, as to where are they going now? Who are they talking to now? While they don't have that teacher, do they have a family member, or a neighbor, or a friend that they, might have a safe word with, that they can get out there that there's something happening?
Mm-hmm.
I definitely agree. Our numbers have gone down significantly since this started, and because educators are mandated reporters, and a lot of our reports come from the educational system. So it's very concerning what's actually going on. And I think once we're in a little better place, we're going to get a lot of reports about stuff that we didn't know what was going on.
Yeah.
Right.
Yeah.
Yeah.
I think
I
all
agree.
of us
Our through our state coalition, our weekly meetings, the 59 programs, DV programs across the state of Pennsylvania we've all noticed a drop in calls to our hotline, but we're thinking that when this is all over, we're probably going to be, inundated with a lot more.
Mhm.
Dee Dee, I went and took a look at last year's child abuse reporting for Childline, just to kind of get an idea of what the impact is to have children separated from so many mandated reporters in our community. And last year, to give you a snapshot idea, 84% of the total of the reports that were made to Childline were made by people who are considered mandated reporters. So that's the vast majority, and of those, 29.2%, and this is the highest category of reports made, came from school employees. So teachers, paraprofessionals, folks who are connected in the school system and seeing children on a daily basis and getting to know them really well. The second highest category are the social service agency reporters. So folks like our counselors at SARCC, folks at DVI, the people who are connected through, food services or, I'm trying to think other things like after school programs or youth advocate, things like that. Those are the folks who are the second highest reporting category, making up another almost 20% of the reports made. Child care workers, which I know is another one that I have young children at home right now. One's in school, two are in daycare most of the time. And child care workers tend to make 3% of the reports that were made last year. So I think we'll see a significant drop in reporting, but I absolutely agree with Jennifer that I expect that there'll be a little bit of a boom in reporting when mandated reporters are connected back with their young people in the communities.
Yeah, that's definitely a tough problem to deal with in these times. I know that many teachers have been trying to adapt their classrooms to digital. I know we've seen teachers doing Zoom calls. So in that situation where you're on a Zoom call with 15 kids or so, are those mandated reporters still scanning for signs that there might be neglect or abuse in a household? And how does that change the process of how that report is made? What does that look like?
Well, mandated reporters are still mandated reporters no matter where they're at in the community. That was one of the really big changes that went into effect after the Sandusky case at Penn State. It became no longer that you were just required to make a report in your professional role or capacity. I'm a mandated reporter if I'm walking through the grocery store and see something, or walking through my neighborhood and see something that's happening. So just because those educators or folks who are doing Zoom calls, or like at SARCC, our counselors are doing a lot of teletherapy right now, just because they're not physically in space with young people or with families, it doesn't mean that they shouldn't or can't make a report, and are actually required by law to do it, even though they may not be performing services in their usual way or capacity.
Yeah. Anything else to add on that? Is there any kind of special things people should be looking out for when they're on, on these kind of conference calls, or something different than you would expect in a household kind of Skype call than you wouldn't necessarily see face to face with a kid?
Yeah, well, I don't know about Jen and Sharon. I know one of the things that our staff have talked quite a lot about in making the transition to doing telecounseling and teletherapy is that we don't really have the same expectations for confidentiality that maybe we would. So we may, when we work with with survivors and provide therapy in a one-on-one setting. It's in our office. There's sound screens. We can invite children to talk with, a trusted counselor, caring adult, with or separate from their parent or guardian or person who brought them. And sometimes it's really hard to talk about things like experiences of sexual abuse in front of someone that you love and care about, or that, may have, you feel as, a part of the abuse or complicit or brought the person into your life. That happens in a lot of sexual abuse cases. So our staff are really concerned that they're not going to get the same disclosures, even if they're providing the ongoing therapy or treatment to folks during this time.
Yeah.
Right. I would agree with Ali, that kind of safe space, if you will, that they have when they're in a room with the counselor, is kind of like gone when they're doing the, over the computer or on the phone or something. They've kind of lost that safe space. So they might not disclose or talk about things that are really happening. Yeah.
Mm-hmm.
I think a lot of our high-risk clients aren't going to be cooperating with those Skype calls. They're probably going to avoid them, and because most of it's not mandatory, that really they're going to lose sight of those kids.
Mm-hmm.
Yeah. I kind of want to switch gears and talk a little bit about how all of this social isolation and everything that's been happening with government restrictions on what businesses can operate. How has that affected your operations, Child Protective Services and childline workers? Are folks being furloughed, or are they still functioning in their full capacity? What kind of issues have you run into on the back end there?
I mean, Childline is still in their full capacity. They're working from home as we are too. In some counties, there has been some furloughing, but not in Lebanon County. And our staff still is making contacts face-to-face with clients when there's safety concerns. We're taking whatever precautions, social distancing, as well as protective gear, but we are required to continue to try to see them. So anytime there's a safety issue, we are still making contact.
Mm-hmm. Anyone else have something to add about, how your operations might be changed?
Well, with us, I mean, it's kind of, we're still open. We still are sheltering individuals to keep them safe. Transportation has become an issue with transporting clients. The taxi cab service in Lebanon County is not working. I'm not sure about the bus schedules in Lebanon. I'm assuming that they've kind of, changed their schedules a little bit. And just, transporting in a vehicle on your own, whether it's a business owner, we don't transport in our personal vehicles, but that's a concern. So it is kind of difficult, but I just want to let people know that we are open. We are here, to keep, that vulnerable population safe. And I mean, we do know that they're home, they're quarantined, maybe people aren't working, obviously. So calling is difficult, reaching out to someone is really difficult. But the police are, obviously are still out there. So reaching out, hopefully the police, if they need to shelter, is always an option.
Yeah. Ali?
Well, bringing that up, I'm sorry.
No, go ahead, Sharon.
Our office number is no one's answering that line right now. So most of our calls are being filtered through police dispatch, which is 717-272-2054, which is the non-emergency EMA line. And they reach out to our workers and find out who the appropriate person to respond to that is.
Mm-hmm.
Yeah, so for SARCC, and I think this is true for all three of us on the interview today, we're all considered essential service providers by the state of Pennsylvania. The crisis response, the social advocacy, the child welfare, even adult welfare. I was really pleased to see that we were considered essential service, because what we do doesn't stop just because there's a pandemic happening. People still experience crisis, still need to connect with their counselors or therapists, still have a need for shelter services. There's still a need to investigate any known allegations of abuse. I think, I agree with Sharon and with Jennifer. There's steps that we've taken in order to ensure the safety of our staff and the survivors and clients and community groups that we've been serving. We moved our office to a limited staffing capacity. So because not everybody has access to phone or to technology. We wanted to make sure that there was still opportunity to access services. So there's one staff member posted in each of our offices at least 3 days a week in order to manage any walk-in or crisis appointments, or someone who can't access the phone or telecounseling for support. Any previously established counseling appointments, we've worked with those folks to help them transition to use of a secure online platform for counseling and therapy. We're using Doxy for that, and are working with folks so that we can help families and individuals to understand how they can continue doing their healing work and meet their goals related to the therapy that they're receiving, or grounding techniques or things like that. And our staff are working pretty hard to, in almost no time or notice, builds complete capacity to continue providing services to survivors. Our hotline remains open 24 hours a day, and we're still providing services out in the community. I was talking to a staff member yesterday who goes to the Children's Resource Center to do advocacy and accompaniment for families who go for forensic interviews. And I was like, well, how are you doing? Like, how does it feel to be going out and to be meeting with people? And of course he's practicing good hand washing and social distancing, and we're cleaning everything often. But he was like, this is what we do. Like, I'm ready to go and to help and be with families and be with them during this time, even though it's a weird time. So our staff are really just phenomenal. And I think all three of us probably have that same experience.
Mm-hmm.
Yeah. I think we're seeing that all over the community, people stepping up in this time and being brave and going out and doing their job and helping people. So thank you all for being a part of that. I'm also curious with kind of the limited activity that we're seeing in the legal system right now due to the stay-at-home orders and the essential business orders. Does that have an impact on our ability to keep kids safe, that, legal processes are kind of slowed down in a way?
So one of the things that, I read this question ahead of time, and I was really thinking about what would we expect in a normal circumstance. So of course, SARCC deals with child sexual abuse and sexual abuse survivors. And I say this all the time, it's really the expectation and not the exception that a survivor of sexual abuse may wait to talk about it. And that's true for child survivors as well. It's not unusual that a child will wait to disclose an experience of victimization, and that's for a whole bunch of reasons. It could be that they were manipulated by the person who is abusing them, made to believe that they would be in trouble or at fault if they ever talked about it, or it's part of an ongoing or long-time grooming process. So with child sexual abuse cases, which are the majority of cases that go to the Children's Resource Center for a forensic interview, it's often something that's not like an eminent scheduling. So it doesn't have to happen within like a certain amount of time for evidence collection. If a child discloses that something happened weeks or months or even years ago, it may be something that can wait to be scheduled for a forensic interview. So the SARCC, for example, has made some adjustments to how they're operating or practicing. They've continued to see folks and to do the appointments that were already scheduled, but they've also kind of worked with District Attorney's Office and CYS and the different counties that they serve to kind of make measured decisions about how necessary or how eminent the risk is that the child is seen. So if there's a risk for safety in the home, that's going to be launched to the top of the list, and they're going to schedule that right away. If there's a risk that there was physical abuse or, a medical need to be seen within a certain amount of time to gather evidence or to get photo documentation, those are being scheduled right away. But if it's something that could, in theory, wait a few weeks or a few months, they may hold off on scheduling that.
Mm-hmm. Anything else to add to that, Jen or Sharon?
Well, I mean, on our end, the physical abuse, if it's happening normally, I mean, a lot of times the adult victim in the home or the non-abusive parent will file for a protection order. That involving a child goes directly to the Lebanon County Children and Youth. And unlike Ali had said, sometimes they don't disclose right away, only if they're in our shelter, and talking with the counselor or, or just the shelter advocate, they'll say, about things that are happening in the home, and then we will report it, through Childline and follow, that guidance.
And, when we've gotten in situations where we had to take legal custody of children, we're still having emergency hearings because we find ways to make that work. And our judges and our court system has been pretty creative in making that happen. Most hearings are continued, but anything that's an emergency is still happening.
That's really good to hear. So another thing that I've been curious about is whether or not the economic stress is going to affect rates of abuse. I don't know if any of you know if there's any kind of statistical correlation between that. We know we're seeing fewer reports right now because there's just an access issue with kids and other adults. But are the actual rates going to be increased because of this situation as well?
I believe they will. I believe once, this comes out where people are out and moving around, we personally, I think we will find that we'll have more phone calls with people looking, for our services, whether it be shelter or the counseling piece. I think right now a lot of the victims are at home worrying about the basic needs, the food, the housing, and the childcare, and trying to keep everything calm. But I really do believe that once that opportunity and this stay-at-home order is lifted, I think we're going to see more phone calls being made with more people wanting to access our services and wanting to leave.
Yeah.
Yeah, and I think I would agree with that. I think, statistically and what we know worldwide is a factor is that there's a correlation between poverty and joblessness and homelessness and higher rates of both victimization and perpetration. So I think, if everything that we've known up to this point is any indicator, it's to be expected that economic stress, economic hardship, job loss, all of those things would increase just general stress and would likely affect rates of abuse as well. There's been a long-standing connection between poverty and risk factors for violence, and so there's no reason to suspect that it would be different for this case. I think one of the things that I think about so often, we're privileged to be able to, the four of us sitting in our homes to have this conversation, to use technology to be able to continue to educate the community. But I think one of the things that is going to be really, brought to light and put forth as a result of this pandemic experience is that the people who are the have-nots in our community, people who experience oppression, hardship, undocumented status, have struggles with housing stability or food access, their experiences are just going to be stressed to the max. So if we have the privilege of being able to have access to technology, to support, to resources, that's wonderful, and it's hard still. If you do not have those privileges, do not have access to technology, don't have a stable internet connection, or don't regularly have access to food, now it may be even harder. We went to the grocery store for our needed, supplies yesterday, and things that maybe would be staple items that a low-income household might need or have normally be able to access are pretty hard to come by. Macaroni and cheese or ramen noodles, things that give you a lot of calories for a pretty low price tag. They're being gathered up in mass by just the general public out of fear and wanting to have access to food in our own homes. And so we'll really see that there's an increased need across our communities in a lot of different spaces.
It's a great point, Ali. Anything to add to that, Sharon?
I mean, I would obviously agree with what both of them said. We've had clients reach out to us that we're actively involved with who have asked us for assistance. Luckily, there's a lot of community partnership that does have services available. We've found ways. We had a client that refrigerator broke, so we had to help her get a refrigerator and food bank. I mean, and the schools are still providing school lunches, so I think that's helpful. So anything that would alleviate that stress, I think would help.
Yeah. And I think we're in a really unique situation right now because it's not like a regular, recession where, yes, there's economic stress, but, people are cooped up in their homes on top of that. So you have that stress and you also have whatever family stresses or home life stresses that you might have normally. So it's hard to kind of get a chance to breathe in that environment. So I have another question, and this one might fall kind of more into Jennifer's purview. I'm wondering, what advice would you give to an adult who's in a domestic violence situation during this pandemic?
Well, the advice I'd like to give obviously is to stay safe, to have a safety plan in place, and to reach out to, currently in this situation, to law enforcement, if you're in a domestic violence situation, to maybe hopefully have them help you get out of that situation. To know that, we are open, we're 24/7, our hotline's available 24/7. Our shelter is available, to keep them safe. But I cannot emphasize enough the safety planning piece for victims, and their children to have that, to get out, even if they can get out, to go to a neighbor's home. I know we have to keep the social distancing, but to express the emergency, asking them, to call 911 if your phone was taken away, but safety plan is what I would truly emphasize at this point.
Mm-hmm.
Yes.
Sharon or Ali, do you have anything that would complement Jen's response?
I think, one of the things that our counselors and therapists are really seeing is that people are needing to find new ways to work through the coping strategies that they've maybe already established. So if your coping strategy is to get out and go to the library in order to have some quiet time, if you feel really stressed or overwhelmed by something that's happening, that's not an option right now. If your coping strategy is to go to a yoga class or connect with people in the community in some way, those are things that you're going to have to find adaptations for. And there are great resources out there, and there's a lot of people in our community. I watched the interview with Dr. Martha Thompson and Brenda Sartoni on Tuesday about mental health and anxiety and crisis during this time. Be gentle with yourselves, folks. Take care of yourself and find new ways to do it. We all have the ability to do that, to be kind with ourselves, to take care of ourselves. And there are a lot of people in the community who want to help you find those new methods or new coping strategies so that even if it is a really difficult time, you're not going through it alone. You can still connect and heal and grow and find new ways to do those things.
Thanks, Ali. So my last question for today is, how can we as a community take collective responsibility for the safety of our children? Sharon, do you have any?
I mean, if you see something, say something. That's common practice. If you see something in your neighbors or something's going on, sometimes people see things on social media that's concerning. Report it to the appropriate authority. I mean, the first responders are still out there to help the children and the adults who might be at risk.
I would agree with that.
Yeah. I think about some of the strategies that we talk about in our prevention programs. And I think even with social distancing, there's still a lot that we can be doing to care for one another and to be upstanders in the community. I think back to the statistics about reports of child sexual abuse or child abuse in general. And most of them come from people who maybe aren't seeing children right now, educators, social service providers, folks in the community. So if you as a professional and you're listening to this and you think, like there's a family that I'm really just very concerned about, or I could see this being a high stress or anxiety situation for them, or maybe they don't have the coping skills or access to the resources, finding ways to connect with them and just really do like an authentic check-in can go such a long way. One of the strategies for bystander engagement, so how you as someone observing problematic behavior or things that are happening in the community, whether it's on social media or you walk past a house or whatever, can do something in order to de-escalate the situation. Some of those can still work. So you walk past your neighbor's house who normally you would see on a really regular basis and you hear screaming and yelling. Maybe it's reaching out or giving a phone call to see, like, hey, I just wanted to check in with you. These are really stressful times. Is there anything that I can do for you? Or, is there something that I can help with? And while you may not be able to, prevent every single thing that happens, sometimes just giving that authentic care and connection and an opportunity to vent and to let go of anger or frustration that's happening, that can actually go a really long way. So diffusing situations or de-escalating situations that you see or observe, or thinking through the families or community connections that maybe you're particularly concerned about because, like, oh, I haven't talked with them. We haven't been able to connect for telecounseling or for after school program. I'm maybe just going to give them a quick call and just see how things are going and what their stressors are like these days, or, give the parent or give the child an opportunity to just say like, hey, like my sibling is driving me up a wall and I don't know what to do about it. And just finding ways to make those authentic connections and use our de-escalation or divergent strategies to help diffuse situations before they escalate into something more intense or worse, and builds that resilience for the families and community members who just really need it.
Yeah, absolutely. Jen, anything to add to that? How we can keep kids safe as a community?
No, I just think it is, to listen. If a child reaches out to you and, has something to say, listen to them, just listen to what they have to say and reach out to the, the agencies, the people that are available to help, that we're here to help with that.
Yeah. Well, thank you all for being with us today. I really appreciate all the work that you are all doing in our community to keep kids safe. And I hope that you're all taking care of yourself and, taking a little time to make sure you're doing your own self-care. We really appreciate everybody who's live joining us today. If you're still looking for ways to help, visit the United Way website. We have a community fund that's working so hard to support our nonprofits who are seeing different needs than we usually see during these times. Or you can text Help for Lebanon to 414444. So thank you everybody for joining us. I hope you all have a wonderful day and a great weekend with your families. So I think Flame is going to take us out and end the broadcast. Hope everybody.
Thank you.
Yep.
Thanks, Dee Dee.
Yep.